The prostate is a small, walnut-shaped gland that sits just below the bladder in men, wrapping around the urethra, the tube responsible for carrying urine out of the body. Despite its small size, the prostate plays a vital role in the male reproductive system, producing a fluid that, together with sperm from the testes and other secretions, forms semen. This prostatic fluid nourishes and protects sperm, enhancing their motility and ensuring successful fertilization. The prostate itself is divided into several distinct zones: the transition zone, central zone, and peripheral zone. Each of these areas has its own unique cellular makeup and function within the gland. Surrounding the secretory glands and ducts of the prostate is a dense layer of fibromuscular tissue called the stroma. The stroma, along with the glandular tissue, forms the bulk of the prostate. Throughout a man's life, the prostate is heavily influenced by hormones, most notably testosterone. Testosterone is the primary male sex hormone, and it is essential for the growth, development, and maintenance of prostate tissue. Within the prostate, stromal cells express an enzyme called 5-alpha reductase, which converts testosterone into a more potent form known as dihydrotestosterone, or DHT. Dihydrotestosterone plays a crucial role in the normal development of the prostate, especially during puberty. However, as men age, DHT can accumulate in the prostate. This accumulation, combined with a natural decline in circulating testosterone and a relative increase in estrogen, sets the stage for conditions such as benign prostatic hyperplasia, or BPH, and, in some cases, prostate cancer. Benign prostatic hyperplasia is a non-cancerous enlargement of the prostate gland. It is extremely common, especially in older men. In BPH, both the glandular epithelium and stromal tissue within the transition zone of the prostate begin to proliferate, forming nodules that expand the tissue. Over time, these nodules cause the prostate to enlarge and press inward against the urethra. This compression can partially or completely obstruct the flow of urine, leading to symptoms such as difficulty starting urination, weak stream, frequent urination, or the feeling of incomplete bladder emptying. While BPH is not cancerous and does not increase the risk of prostate cancer, its symptoms can significantly impact quality of life. Prostate cancer, on the other hand, typically arises in the peripheral zone of the prostate. Unlike BPH, which is characterized by the slow and controlled proliferation of normal prostate cells, prostate cancer occurs when the glandular epithelial cells mutate and begin to divide uncontrollably. This unchecked growth leads to the formation of abnormal glands and, ultimately, one or more malignant tumors. In its earliest stages, prostate cancer may not cause any noticeable symptoms. However, as the tumor grows, it can compress the urethra, disrupt the normal flow of urine, and even cause blood in the urine or semen. What makes prostate cancer especially dangerous is its potential to spread, or metastasize, to other parts of the body, including bones, lymph nodes, and distant organs. The distinction between benign prostatic hyperplasia and prostate cancer is crucial, both for diagnosis and treatment. While both conditions may cause similar urinary symptoms due to compression of the urethra, their underlying causes, progression, and management are very different. In BPH, the primary problem is the overgrowth of both glandular and stromal tissue within the transition zone. This overgrowth is driven by hormonal changes, particularly the conversion of testosterone into dihydrotestosterone. As a result, one of the mainstays of treatment for BPH is the use of medications called 5-alpha reductase inhibitors. These drugs work by blocking the enzyme responsible for converting testosterone into DHT. By reducing DHT levels, these medications help shrink the prostate, relieve urinary symptoms, and improve quality of life. Other treatment options for BPH may include alpha blockers, which relax the smooth muscle in the prostate and bladder neck, or minimally invasive surgical procedures to remove excess tissue. Prostate cancer, however, requires a different approach. Depending on the stage and aggressiveness of the cancer, as well as the patient's age and overall health, treatment options may vary. For localized prostate cancer, cancer that is confined to the prostate, one common treatment is radical prostatectomy. This surgical procedure involves removing the entire prostate gland, along with select surrounding tissues. In some cases, other surgical interventions, such as transurethral resection of the prostate, or TURP, may be used to relieve urinary symptoms, though TURP is not curative for cancer itself. For more advanced cases, or when the cancer has spread beyond the prostate, additional treatments may include radiation therapy, chemotherapy, and hormone therapy. Hormone therapy aims to lower the levels of male hormones that fuel the growth of prostate cancer cells, either by medications or surgical removal of the testes. Despite these differences, both benign prostatic hyperplasia and prostate cancer have certain risk factors in common. Age is by far the most significant risk factor for both conditions. As men grow older, the likelihood of developing BPH or prostate cancer increases. Family history also plays a role, as men with close relatives who have had prostate problems are at higher risk. Additionally, lifestyle factors such as diet, exercise, and exposure to environmental toxins may influence risk. Early detection and proper diagnosis are essential. Regular screening, including digital rectal exams and prostate-specific antigen, or PSA blood tests, can help identify prostate problems in their earliest stages. While elevated PSA levels can be a sign of either BPH or prostate cancer, further testing, such as imaging studies or a prostate biopsy, may be necessary to distinguish between the two. In summary, benign prostatic hyperplasia and prostate cancer are two distinct conditions that affect the prostate gland. BPH is a non-cancerous enlargement that can cause bothersome urinary symptoms, but is not life-threatening. Prostate cancer, in contrast, involves the uncontrolled growth of malignant cells within the prostate and has the potential to spread to other parts of the body. Understanding the differences between these two conditions, how they develop, how they present, and how they are treated, is crucial for maintaining prostate health and ensuring the best possible outcomes for men as they age. Regular medical checkups, awareness of symptoms, and a healthy lifestyle all play important roles in the prevention, early detection, and effective management of both benign and malignant prostate conditions.